Tonight on InFocus, we're raising awareness about the cancer of the esophagus. And joining us now to talk about the risk and treatments is Mindy Mintz Mordecai, founder and president and CEO of the Esophageal Cancer Action Network. Mindy, thanks so much for coming in.
Thanks for having me.
So you talk about this survey that you just recently did and found out about 14% of the people don't realize.
Most people have no idea that reflux disease can cause cancer. And the Esophageal Cancer Action Network this week filed a petition with the Food and Drug Administration asking that they put warning labels on all the over-the-counter reflux medications that are sold. 15 million people taking this stuff every year. They're buying the Tums and the PPIs and all these things over the counter. Really. And there are warning labels on them now. They say you shouldn't take them for more than 2 weeks, but we know that people are ignoring those labels. And the problem that we have with them is that they say it could lead to a serious condition, persistent reflux, but they don't tell you what that condition is.
That's cancer.
And we think people need to understand that persistent reflux can lead to esophageal cancer, and esophageal cancer is the fastest increasing cancer among American men today. It is also one of the deadliest. Only 1 person out of 5 will survive this disease more than 5 years.
Well, you know, and so this also means that acid reflux maybe should be taken a little bit more seriously.
Absolutely. I mean,
because I was told that I had that, and I was like, oh, take a couple of pills and you'll be fine.
Right. And the thing about it is that there is such a lack of awareness among even our medical professionals. And because esophageal cancer has grown, this type of esophageal cancer has grown in the United States by more than 600% since the 70s. And so a lot of doctors who were trained earlier than that, they aren't even concerned about it because it's not even on their radar screen. And a lot of folks haven't really been paying attention to it. It's kind of snuck up on us. Well, you know, I'm here to tell you that it's a horrifying thing to experience if you lose somebody you love to this disease, because your chances are really slim by the time it's caught. It's usually,
what are the warning signs?
Right, so here's the problem. It's usually silent until you can't swallow. And if you can't swallow, it means you have a tumor large enough to block your esophagus. So in my husband's case, he had no idea he had reflux because the symptom he had when he laid down at night was that he would choke. So when we conducted this survey of Americans, more than 75% could identify heartburn as a symptom of reflux, but less than 50% could identify things like a persistent cough, a hoarse voice, that choking my husband did when he laid down at night, a sore throat. President Obama was diagnosed with reflux after he had a sore throat for 6 weeks and his doctors couldn't figure out what was wrong. So there's a lot of awareness that needs to be raised. People need to pay attention to the symptoms they're having, and they have to understand that heartburn isn't a thing you should just live with. You need to speak to your doctor about whether you need to be checked, because the only way we're going to know if you're at risk right now is if you get that check. And if we catch it at an early stage, there's something called Barrett's esophagus. It's a precursor condition, and we have great techniques now where we can go in, and not me, obviously, the doctors can go in and treat this condition and eliminate.
It's like a scope that they put down your throat.
They put a scope down, and they can use different techniques to ablate that precancerous condition, and then you never have to go on to ever have cancer. And if you think about the options being never having cancer or trying to battle a cancer that has such a low survival rate, to us it's a no-brainer. You need to talk to your doctor if you have persistent reflux, and you need to pay attention to these symptoms. And that's why we want the FDA to put these warning labels on medication so that that 14% that knows now, we want them to understand that the medication is not protecting them, and then we want to see a lot more than 14% understand that you're not just supposed to live with reflux and take these medications.
All right, Mindy, thank you so much for coming in.
Thank you.
Appreciate your passion and conviction, and hopefully we can spread the word. Thanks.
All right.